Okay, so but when it comes to pediatrics, you have to memorize this orthopedics of pediatrics too, because it's important. The especially this one DDH, leg calf parthis, and especially for the old, little bit old children's, like starting from 4 to 8, 9 to 10, making their diagnosis. Is it a growing pain or is it something else going on? Usually they present with a lot of pain. So that's why even in the scenarios they say there is a lot of pain and all that. So you have to know if this is a male, it's more common in this one. If it's a female, it's more common in this one. And like what kind of presentation is there. So that's why it's more important whatever you are doing from here. Okay. So we'll stick up to this much and then we'll continue from here and finish the orthopedics and then we'll go to neurology. Tomorrow we'll do neurology and rest of the emergency medicine. Okay, and try to read this one whenever you are reading orthopedics. Do their x-rays, do look at their pictures, do look at how the presentation is, their mechanism, how does they develop the injury, and what are their main complications. That's very very important, that because the diagnosis usually in orthopedics they do like to make a lot of diagnosis and finding out if this doctor knows it's a limb threatening, if it's a life threatening, or how to approach the case. Okay. So do figure out everything and then read a lot of these topics over and over the time. Even if you don't have enough time, at least read the pediatric one. And since we just read this one, DDH, that's important. Then slipped capital femoral epiphysis, this is important. At least read these ones too and see the picture of how the baby presents in family medicine practice. Like, you can go to Google and see because even if on the way they look and the way their leg is, you can tell that this is basically what's going on here. Okay. And the age factor is very very important. So yeah, I think that's pretty much it for today. We'll continue from here on tomorrow. We'll try to finish this one and maybe we can extend a class a little bit more for yesterday. Okay? We'll maybe take 15-20 minutes more. So tomorrow it will finish around 10. Any questions from yesterday class? Okay, I would suggest do a lot of MCQs from this one. Do a lot of X-rays. Even when we're doing emergency, X-rays are important. The pictures are important. How does it present? I think in the last chapter when we were doing the rib fractures, I forgot to mention even the rib fracture, they can show you the picture as well. I mean, it's very less likely they do put the pictures, but in my exam there was a lot of pictures. But other people they did not get any pictures. So it's my whatever I got. That's why I'm telling you to look for the pictures as well. Even for skin diseases, they didn't say anything. A patient presented, this is the picture, and I got a lot of pictures, right? So that's why I'm telling you, you could be the unlucky one. I'm not sure because I was the unlucky one. My whatever other fellows did not get any of the pictures, but I do got a lot of pictures. So to keep yourself on the safe side, just whenever you are reading any topic, if there is any related to any of picture or any presentation that needs to be seen, any x-ray that needs to be seen, any dermatology presentation that needs to be seen, just see the pictures. Okay. So keep yourself on the safe side that you see one time. So even if you see it one time, it will stuck to your head. Okay. So yeah, anything else? And then you can always, whenever you are seeing a picture, you can always keep it in your, Google, sorry, in your gallery, and then, write down the diagnosis on it that this is the diagnosis and this is the picture, how it looks like. Even if I find something related to that, because I did not studied with the pictures, but whenever I was doing a topic, I did see a picture. Okay. So it helped me a little bit in that way. So, yeah, okay. And then do read this one. If you have any questions, we will discuss tomorrow. Any question from today? Okay.
Dr. Kainat, can we use the U word for this chapter
Yeah,
or
you can use
AQ
the U
bank?
word. No, you can use
Okay.
the U word. If you have ASQ bank, go for ASQ bank. Like
Mm-hmm.
your preference should be ASQ bank if you have ASQ bank. If you don't have ASQ bank, you can use U word. I only use U word. So I was good enough. Okay.
Okay.
So, yeah. Then do this one and then we will see tomorrow. Even if I find any PDFs where I have any pictures and stuff, I will do share it with you guys. And if you guys have it, then you can share it with each other. Okay? Then we'll see you tomorrow. And yeah, and we do neurology. Okay? First, we'll finish this orthopedics and then we'll continue neurology and then we'll start emergency medicine again. Okay? Then we'll see you tomorrow.
Thank
Um,
you.
yeah, thank you so much.